Hello everyone, I'm Dr. Karen.amaniampong and welcome back to Sweet Talks with Kay. This is the second part of our video. The first part was about infertility, and as my guest, I still have my daddy, Dr. Kofi Amaniampong. If you haven't watched the first video, which is about infertility, I'll leave the link down in the description box so that you can watch that and then catch up with this very one. So today we're talking about the interesting and quite controversial topic of IVF, which is in vitro fertilization, and Daddy is here again to talk to us. He is a subspecialist in gynecology. His field of interest is infertility, so he is a fertility specialist and he will tell us a lot about IVF. I find it very, very interesting. It's one of my topics of interest in gynae, and it should be quite insightful for every one of us, and we'll each learn something new today. So welcome back.
Thank you.
Okay, so what is IVF? We are digging right in. What is IVF?
Well, IVF, before I start, I would want to use this to demonstrate what it is. This is the natural process of becoming pregnant. A woman becoming pregnant.
So fertilization.
Now, this is the fallopian tube which has been magnified, and the sperm and the egg has been produced by the ovary, and then the sperms have managed to get there around the ovary, and one of them is entered into the egg, and then that is the egg that have joined together, the egg and the sperm that have joined together to produce the baby, which is called the embryo. Now the embryo starts dividing as it goes on, and within about 7 to 8, 9 days, it gets into the cavity of the uterus and deposits itself, implants itself into the uterine cavity, and that is how pregnancy naturally occurs. But when we talk about, some people have not gotten the opportunity to have this to occur naturally, so then we have to find a way to do it. And the way that is done is called in vivo. This is in vivo fertilization, and then we are going to do in vitro fertilization. And that is what is called IVF.
Okay.
So IVF is the egg and the sperm joining together outside the body in a laboratory to create a baby.
Okay.
And the baby, which is called the embryo, is transferred into the uterine cavity of the woman.
Okay. So there's a difference. In vivo is the natural process where someone falls pregnant, the sperm is introduced during sexual intercourse, and the ovaries, the eggs are not taken out. But in vitro fertilization, the eggs are retrieved and joined to the sperm in the lab. So there's in vivo and vitro, that's the difference. In vivo is inside, in vitro is done outside. So how is this done? You've just explained it, but there's a beautiful picture here that we can use to So it says here the miracle of human life. Indeed, it is a miracle.
So the whole process, just like I described it, is that's the egg, and which will be taken out. That's the sperm, which is also will be taken out from the man, and the two will be joined together in the laboratory, and that's the sperm which is going to enter into the egg to make a baby, and then it will naturally go on in various stages, and at the end of it, that you have the baby formed, which this is after 9 months the baby had been delivered. So that is simply IVF process.
Okay, so it's not about a baby being grown in a tube somewhere in a lab and being handed over. So it happens in the lab, and then the embryo is deposited into the mother.
Yes.
And then the pregnancy is carried by the woman.
For a period of 9 months. Okay. So the baby is manufactured in the laboratory, implanted into the woman, and then the woman, it will progress on 9 months to become a baby.
Okay. And how long does it take? What's the process? Can someone just get up from her home on a Monday and come on a Tuesday and do IVF?
Not really. You will need about 2 months. The first month is that the doctor will use it to prepare your womb and prepare the man properly. Then it is the second month that the whole process will take place. And the whole process takes place as if with the menstrual cycle. You start with the first 10 days giving injections or drugs for the woman to produce maybe about 3, 4, 5, 6 eggs, which will be retrieved and then put into a test tube or put into a medium with the sperm to fertilize. And after fertilization for about 2 to 5 days, the baby, the embryo, is taken and put into the womb. Okay. So that is the process.
Okay, so you can't just get up and come and expect it to be done the same day or the next day. It's a process and it needs a little bit of patience.
Yes.
Is it a painful procedure?
No, it's not a painful procedure. The painful aspect is where the injections that are given over that period of between 10 and 14 days. So all the tablets, if you are taking tablets, then it's not painful. On some occasions, the woman may be asked just to take a tablet only to produce the egg. Okay. But it's the injections that is painful. The actual transfer of the baby into the womb is a very painless procedure. It's a painless procedure.
So how is that done?
It is done in the laboratory at the appropriate time, and the baby, the embryo is put into a small tube and transferred through the cervix into the womb.
And do you have to be awake for that?
Yes, you have to be awake for that. Most of the time, you have to be awake for the time. But occasionally, but for the retriever, you need to be anesthetized to be able to retrieve the eggs from the abdomen. Yes.
So anytime I ask you about any complications, you tell me that even riding a bicycle has complications.
Yes. Well, there is nothing free in this world. As I always tell my patients, there is always some small side effect to everything that you do in this life. And the small side effect to the IVF process is the first thing that I've mentioned is the pain of the injection. Then the second side effect or complication that may occur is what is known as hyperstimulating the ovaries, because the doctor doesn't know you and that he is using your figures to try and give you a medication that will make you to produce the egg. So sometimes the ovary may be given too much of the medication, and then it will become a bit more enlarged.
But we wouldn't know, like you're saying, it's only when it's like trying something for the first time, so we don't know if there will be any complications or which complications you have. Because some people receive just a little bit of the hormones and then they hyperstimulate or an overreaction.
Yes, so that's what it is. So you wouldn't know until at the end of it all.
But all these complications that occur can be treated.
Oh yes,
or managed.
It can be managed. Yeah. It can be managed.
Once they are identified.
Once they are identified, they can be managed.
And so we've talked about the myths where people think that the baby is put in the lab. So we've covered that. Are there any other myths about IVF?
Oh, the other myths about the IVF is that people think that the babies that come out are abnormal. But I can assure you that at the present, more than 9 million babies have been produced in the world, and they are being followed very closely. So far, there has not been any big abnormalities associated with it. It's just like the normal pregnancy. It's the abnormalities that we have with normal pregnancies. So it's not that abnormal at all.
What is the age limit? This is quite controversial because you find 70-year-old women being offered IVF. And while we've seen over the last few years, very few success stories, but what really is the age limit for IVF?
The age limit for the IVF is, it depends on country to country, but whatever that we do, we also take cognizance of the baby that is going to come out. First of all, a woman who is more than 35 years, if you become pregnant, we know that you are tied up as being in a high-risk group. So we would want to make it into about the age of 55 for the woman. The reason being that at the age of 55, it may be too risky for the woman to carry. You may be having other comorbidities like hypertension, diabetes, and so on and so forth. So we put the age at 55. Again, we think about the baby, a woman 55 years old producing a baby at that age. By the time the woman gets to 65 and on retirement, the baby will only be 10 years old. So you don't want to leave a baby who has no mother or who has not got a motherly care until he or she is 18 years old. So this is the reason why we pitch it at the age of 55, so that at least by the age of 70, the woman being 70, the baby would have been about 15 years and able to cope, probably a few more years for the baby to be able to cope for itself. So we think about the baby. Okay. That figure is tied up to the baby's interest and also partially the mother's interest. And of course, don't forget about the man, the father. The father may also be an elderly father and therefore on retirement and may not be able to cope financially with the situation.
What are the options for donors? Who needs a donor?
Again, we have, as I've said, about more than 9 million babies have been born into the world, or children have been born into the world through IVF. Half of them are donors, either male donor or a female donor. The male donor is where the man doesn't have any sperms at all, and it is difficult to retrieve a sperm from the testis. And then the female donor is where the woman doesn't have sperms, either due to age or illness. So there are two groups of people who need, either for the male purpose or for the female purpose.
Okay. So other than IVF, what other options are available? Because we know that IVF is not 100%, the success rate is not 100%. That's the reality of it.
And it is true. No hospital will guarantee you 100% all over the world. Unfortunately, the rate depends on where you go, and it's between 15 to about 60%. And that depends on the age of the woman, the status of the womb, and then the male partner, the sperm. So it is not 100%. So we need to take this into consideration.
Mm-hmm. Mm-hmm. So there is surrogacy?
Well, the other option is, apart from the donor aspect, nowadays, as I've said initially, for infertility, some of the cause of the infertility may be due to the womb. Mm-hmm. And in some hospitals abroad, they are doing uterine transplant.
Which is a womb transplant.
Womb transplant. Transplanting somebody's womb into another woman's womb so that you'll be able to carry. But that is really, really very scientific process which has not become very well.
Has there been success? Have there been any births?
Yes, there has been a few births here and there through that. But if your uterus is not too good, your womb is not too good, then you might get another woman who has a very good uterus to carry your baby for you. And that is what is known as surrogacy or gestational carrier. You are just carrying the baby, and at the end of the 9 months, you give it back to the owner. And so that is another. The other option is, well, sometimes we will need to do not the IVF, but ICSI. And ICSI is where the the sperm is not that too powerful to be able to enter into the egg, and therefore you have the egg with the sperm in here being injected into. So ICSI is intracytoplasmic sperm injection, and it's been abbreviated into ICSI. That is, the sperm is injected into the egg so that you can have the nucleus of the sperm entering into the nucleus of the egg to form a baby. Then you have, if these are not successful, then we will have to think about adoption, where one will have to adopt. Unfortunately, you will have to adopt if you still want to have a baby. Then, if all these are not too appealing, then probably the couple might decide to stay without babies and enjoy their marriage together as a couple.
Okay. And lastly, there is egg freezing. I have a couple of colleagues and friends. We've had quite a discussion about this. Some people at this very moment feel like they don't want to have any children, but there's a chance that they might change their minds. Also, some of them haven't found partners, so they don't know what to do. Well, some do know what to do, but there are ladies out there who don't know about this option of egg freezing. Personally, I'm an advocate for egg freezing, and I would like everybody to know about it. And if they have the finances and they want to, they should consider egg freezing. But what's your take on egg freezing?
Apart from the egg freezing, we can also freeze the embryo.
Yes.
So, as you said, you may not have the partner to fertilize your egg, so you want your egg to be preserved for the future use. There are advantages and disadvantages. The advantage is that the egg, in fact, even if you are doing the normal IVF and you have excess eggs, it may be frozen just in case in future you have gotten another partner. That is, you are no more married to the partner that you have. And this is just one of the things that occur in the world. So you can have your excess eggs to be frozen, to freeze. Then the next is that because of your age, as you have said, you are not ready. You don't have a partner. And so you don't want to wait till you get to the age of 40 to be told that you don't have eggs or your eggs are not too good. So you want it to be frozen and to be used in future when you have a partner. But there is a bit of a disadvantage with that. When the eggs are frozen, they must be revived and then to be fertilized to make a baby. So there is a small chance that at the time that you revive the eggs, you may not be able to use it properly because you cannot revive all of them. So supposing you save 10, you may find that at the end of the day, only 5 or 4 have been revived. So that is or sometimes none at all has been able to be revived. So this is a risky process because you put all your hope on that, and at the end of 20 years, 10 years, 5 years, 4 years, or a year later, you go back and it cannot be revived. So one has to be very careful about egg freezing. But the process is there. The procedure is there. Hospitals are offering all over the world. And when you go to a fertility center, ask about that. And the hospital may be able to offer you this opportunity to freeze your eggs. But remember, 50-50 chance.
Putting your eggs in one basket, that's literally what it is. And the other question people ask about egg freezing is when the eggs are taken, say, in 2020, will the eggs also be aging with them? But I know they don't age.
No, they don't age. They will not age because they are made to remain hibernate, that is, remain as it is until it is due to be revived.
That's been interesting. Any last words about IVF?
Well, IVF has been very helpful since it was introduced some years back. The first baby probably now is over, just about getting to 50 years, 40, 45 years. It's been very, very helpful. As I've said, it saved a lot of marriages, because many marriages would have broken down without the help of IVF. But it has its own problems. Some people will not accept it on religious grounds. Mm-hmm. Some people will not accept it for their own personal reasons. And some people dislike that idea completely. But I think that it's been quite very helpful. It is a very stressful procedure that is unfortunately, also it's expensive procedure. Whichever country you go, it's expensive. It's an expensive process. So one will have to go in. Again, as I've said, it is not 100%. So you have to go in with the idea that you are going to try and see whether you'll be successful. My advice is that when you go in to have it, you must make up your mind to continue at least for the 5 processes, 5 chances. Give yourself about 5 chances before you give up. Because if you go in once and you stop, then it means that you've thrown your money away. But if you go in and you try first time, second time, third time, fourth time, of course, your bill may increase a bit, depending on which hospital you go to. But at least I think that it is better to plan for 2 or 3 chances before you give up. So that is my advice. We know the burden associated with it, but unfortunately, if we come to that process in our lives, that may be one of the areas or one of the processes that we can use to save our marriages and save our destiny. Thank you.
Okay. Thank you very much, Daddy. This has been very insightful, exciting, and I learned a bit more about IVF, which is actually my area of interest. So to anyone who has listened to us and has any questions, you can leave your questions down in the comments box and we will answer them for you. If you have any topics you want us to cover again, just leave your comments, leave it in the comment section. And thank you very much, very, 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 very much for being my first ever guest on my YouTube channel. Did you ever imagine that I'll be interviewing you one day?
No.
You didn't?
I didn't.
You didn't see it coming?
I didn't see it coming, but it's a great pleasure to have my daughter.
So it's welcome.
Welcome.
This man was very strict with me. Thank you for watching. If you have enjoyed this, like, share, leave your questions, leave your comments, subscribe most importantly, and catch you again next time. Bye.
Bye.